Go.
Alright guys, welcome back to our channel. Today we're going to be going over glomerular versus tubulointerstitial disease. And so these are kind of umbrella terms. So whenever you have kidney problems, you're typically going to find that it's going to be glomerular or it's going to be more tubular interstitial. And so we're going to kind of go over common things you're going to see with each of these. So we have a nice chart here that just kind of compares them to each other. So this side is going to be glomerular, where this side is going to be our tubulointerstitial disease. So to begin with, we have proteinuria. So if you're finding that there's a problem within the glomerulus, you're going to have an increase in protein in the urine, and so typically that's going to be greater than 3.5 grams per day. Where in comparison, if it's more tubular interstitial, you're going to find that you're going to have less than 1, or maybe none at all. So it's very minimal with tubular interstitial disease. Coming down to sediments, so with glomerular, you're going to find that you're going to have dysmorphic red blood cells, CAS, and lipids within that. When it comes to tubulointerstitial disease, you're going to have few cells or CAS. You might not see any. Moving down to sodium. So when you have glomerular disease, you're going to be having retention of sodium, which is going to lead to edema, because remember that water follows sodium, so you're going to be holding on to water as well. When it comes to tubulointerstitial, you just have wasting, so you're getting rid of all of that water. Hypertension, very common with glomerular. Again, back to that water retention. You're going to be increasing that fluid, and so you're going to lead to a hypertension. So it's harder to get all that fluid pushed through the body. Whereas with tubulointerstitial, it's very unusual to have that hypertension because, again, back to this sodium retention, you're getting rid of that along with the water, so you're hypovolemic. Polyuria, so this is where you're urinating frequently. It's very rare with glomerular. Again, back to things we just discussed, you're holding on to that water. Where with tubular interstitial, it's very common because, again, back to what we discussed, you're getting rid of all that water and sodium. And so we have a nice little photo here drawn by Shannon, our co-host. So this is the glomerulus where that filtration is occurring, and that is where you're having all of these symptoms, where tubular interstitial is typically the tubules or the interstitial surrounding it, which again is causing all of these symptoms. One quick thing, we recently did a video on nephritic versus nephrotic syndrome, and so that's associated to glomerular disease, so it's broken down to those two categories. So just a quick reminder there, nephrotic protein and nephritic red blood cells. And so now we're going to kind of jump to another category. So we talked about sediment here, and we want to go over urine microscopy. So just kind of what these terms are associated with. So dysmorphic red blood cells, this is where you're going to find red blood cells that have lots of different shapes and sizes, and it's because they're being pushed through the glomerulus, and so you're going to find that with glomerular disease. Eumorphic red blood cells, this is more of a urologic disease, so in a few weeks we'll jump into urology, maybe we'll discuss that more there, so you can look forward to those videos. Red cell CAS, this is where you find a pattern where it's
Cells clumped together.
Cells are clumped together, and so this is also seen with glomerular disease. Muddy brown granular CAS, you're going to find this with acute tubular necrosis. We did previously do a video on that as well if you want to check it out. And then white blood cells, you're going to find this with acute interstitial nephritis, so it's due to inflammation and infection. So again, this is just comparing glomerular versus tubulointerstitial disease, which are kind of umbrella terms for common causes of renal problems, and then just kind of what you'll see with each and how to differentiate that. So thanks for tuning in. We'll catch you guys next time.